Rytary is a medication used to treat the symptoms of Parkinson's disease and Parkinson-like conditions. These symptoms may include shakiness, stiffness, and difficulty moving. Parkinson's disease is believed to be caused by a lack of dopamine in the brain, and Rytary works by changing into dopamine in the brain, which helps to control movement. The medication also contains Carbidopa, which prevents the breakdown of levodopa in the bloodstream, allowing more levodopa to enter the brain. Carbidopa can also help reduce some of the side effects of levodopa, such as nausea and vomiting. It is important to take Rytary exactly as prescribed by your doctor. The dosage and timing of the medication will depend on your individual condition and needs. Be sure to follow your doctor's instructions carefully. This medication can be taken with or without food, but it is important to take it consistently with regard to meals. The optimal timing for taking Rytary will be determined by your doctor based on your specific needs. When taking Rytary, it's important to follow your doctor's instructions. The usual dosage is 3 times a day. Swallow the capsules whole and do not crush or chew them. If you have trouble swallowing the capsule, you can open it and sprinkle the contents onto a small amount of applesauce, then swallow it right away without chewing it. You can take Rytary with or without food, but it's best to avoid high-protein and high-fat, high-calorie meals. The manufacturer recommends taking your first dose 1 to 2 hours before eating. Be sure to separate your dose from any iron supplements or products containing iron that you may take, as iron can reduce how much of the medication your body can absorb. It's important to take Rytary regularly at the same times each day to get the most benefit from it. The dosage is based on your medical condition and response to treatment. If you experience any wearing off or on-off effects, be sure to inform your doctor. Do not stop taking Rytary without consulting your doctor, as some conditions may worsen if the medication is suddenly stopped. If you have been using Rytary for a long time or in high doses, your doctor may lower your dose slowly to help prevent withdrawal symptoms. Be sure to inform your doctor if your condition does not improve or if it worsens. Some common side effects of Rytary may include dizziness, nausea, vomiting, dry mouth, trouble sleeping, unusual dreams, or headache. To reduce the risk of dizziness, make sure to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. You may notice that your urine, sweat, or saliva may turn red, brown, or black while taking this medication. This effect is harmless, but it may stain your clothes. Some people taking Rytary have experienced falling asleep suddenly during their daily activities, such as talking on the phone or driving. If you feel increased sleepiness or fall asleep during the day, do not drive or participate in other potentially dangerous activities until you've discussed this effect with your doctor. Be sure to contact your doctor right away if you experience any serious side effects, such as fainting, mental/mood changes, unusual strong urges, new or worsening movements you can't control, easy bruising/bleeding, signs of infection, unusual tiredness, vision changes, severe stomach/abdominal pain, or problems with urination. It's important to seek medical help immediately if you experience chest pain or symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed here. Before taking Rytary, make sure to inform your doctor or pharmacist about any allergies you may have, especially to Carbidopa or levodopa. This medication may contain inactive ingredients that could cause allergic reactions or other issues. It's important to also discuss your medical history with your doctor or pharmacist, especially if you have any blood disorders, breathing problems, glaucoma, heart or blood vessel issues, kidney disease, liver disease, mental/mood disorders, ulcers, seizures, or sleep disorders. Rytary may cause dizziness or drowsiness, and using alcohol or marijuana can intensify these effects. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. Limiting alcoholic beverages is also advised, and if you are using marijuana, make sure to talk to your doctor. Before undergoing any surgery, be sure to inform your doctor or dentist about all the medications and products you are currently using, including any prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Rytary should only be used if clearly needed. It's important to discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using Rytary, as levodopa can pass into breast milk in small amounts and may affect milk production, while it is unknown if Carbidopa passes into breast milk. It's important to be aware of potential drug interactions with Rytary, as they can change how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Rytary include antipsychotic drugs and certain drugs to treat high blood pressure. It's also important to avoid taking MAO inhibitors with this medication, as it may cause a serious, possibly fatal, drug interaction. Most MAO inhibitors should not be taken for 2 weeks before treatment with this medication, but certain MAO inhibitors may be used with careful monitoring by your doctor. Additionally, it's important to be aware that Rytary may interfere with certain lab tests, possibly causing false results. Be sure to inform lab personnel and all your doctors that you use this medication. Remember to always consult with your doctor and pharmacist for the best timing and dosage of Rytary. If someone has taken too much Rytary and is experiencing severe symptoms like fainting or difficulty breathing, it's important to call for emergency help right away. In the US, you can call the Poison Control Center at 1-800-222-1222, and in Canada, residents can contact their provincial poison control center. Symptoms of an overdose may include an irregular heartbeat, changes in mental or emotional state, and worsening of uncontrollable movements or spasms. If you or someone you know is experiencing these symptoms, seek help immediately. It's important not to share Rytary with others. Your doctor may also want to monitor your blood count and heart/kidney/liver function while you are taking this medication. Make sure to keep all of your medical and lab appointments, and consult your doctor for more details. If you happen to forget to take a dose of Rytary, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Do not take double the dose to make up for the missed one. Always stick to your prescribed dosage schedule. When taking Rytary, it is important to store it in a tightly closed container at room temperature, away from high heat, moisture, and light. Be sure not to store it in the bathroom and keep it out of reach of children and pets. When it is expired or no longer needed, consult your pharmacist or local waste disposal company for proper disposal instructions. It is important not to flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.